Okay, this next source is titled Incentive Spirometry versus Active Cycle of Breathing Techniques, the effect on chest expansion and flow rates in post-abdominal surgery patients. So this study was published through the International Journal of Research in Medical Sciences. It was done in 2016. It is a randomized control study, and the study has 90 participants. They're aged 14 to 65. They all received abdominal surgery. They all came into the same hospital with the same unit, and they were all assessed beforehand to make sure that they were eligible for this study based off of the fact if they had previous respiratory problems or complications or anything like that at all. So none of these 90 participants had any respiratory problems in the past. So they were then placed into two groups, just divided in half. The first half had the incentive spirometer that they used, and the others did active breathing. So this was done every 6 hours post-operatively for 15 minutes at a time, and it was done for 5 days. So whenever this was done with the patients, it was documented on a log saying that they had done it, what level they did get to on the incentive spirometer, and the patient did it themselves. So that could be something that might not make it as accurate then if the patient was just logging it to make themselves look good, but they did have documentation of it being done. So the chest expansion and flow rate were continuously recorded as well every day, and the study had ended with the breathing actually being better than the spirometry. So the study said that the chest expansion was 1 centimeter with active breathing, and it was only a 0.5 centimeter with the incentive spirometer. And then the flow rate for the active breathing was also greater, being at 100, and it was only 50 for the spirometer use. Both helped improve respiratory function from what they were previously, and no complications had occurred, but the breathing was significantly better than the spirometer. And then the study just recommended a further study be done for a bigger sample size.